can I welcome everyone to today's Oversight Committee, whose main business before us is to examine the period of time of when London was dealing with COVID-19 from March 2020 to roughly around June, July 2020, and the new arrangements that have been put in place timely in terms of the challenges we face dealing with the pandemic and the recent announcements over the last 24 hours. Okay, so can I also welcome members of the public on the webcast to today's meeting. In accordance with government regulations, we're holding this meeting on an hybrid basis. There are some London Assembly members and guests participating remotely, and some are here joining with me in the chamber at City Hall. I will now call during the debates Assembly members by name during the question and answer session, and I will introduce each guest as they join us. Please can I remind participants to turn off mobile phones and to put them on silent and keep your microphones muted when you're not speaking. Can I ask the clerk to confirm the names of Assembly members who are virtually present at this meeting and any apologies for absence?
Chair, apologies have been received from Assembly Member Berry, and Assembly Member Caroline Russell is substituting for her at this meeting. Members who are present and participating in the meeting are Assembly Member Hall, Deputy Chairman, Assembly Member Bock, Assembly Member Desai, Assembly Member Mccartney, Assembly Member Pigeon, Assembly Member Prince, Assembly Member Russell, Assembly Member Sahota, Assembly Member Shah, Assembly Member Whittle, and yourself, Assembly Member Duval, Chair.
Thank you very much. We've not missed anybody at all, so let's continue then onto the agenda. Declarations of interest. Can we note the list of offices held by Assembly members?
Noted.
Can I also ask members if they have any disclosable pecuniary interest in specific items listed on the agenda?
No.
Okay, I take it as no. I've heard murmurs. Let's move on to item 3 of the minutes. Can I ask the committee to confirm the minutes of the previous meeting held on the 21st of July 2020?
Agreed.
Can I then move on to item 4 on summary list of actions? So additional appendices in relation to this agenda item were circulated as further information to the committee in a separate memo pack. The additional appendices contain correspondence between myself as chair of this committee and the Mayor's Chief of Staff, and also a response to Stop the Silvertown Tunnel Coalition. Can I also ask the committee to note a completed and outstanding action arising from the previous meetings of the GLA Oversight Committee and additional correspondence sent and received? And B, note the additional appendices, Appendix 8 to Appendix 15, containing correspondence between myself as chair and the Mayor's Chief of Staff and the response to Stop the Silvertown Tunnel Coalition. In the response to Stop the Silvertown Tunnel Coalition, it was agreed that as GLA Oversight Committee, I would write to the Transport of London, TfL, to request information regarding transparency surrounding the cancellation cost of the tunnel and the financial viability of the project. Therefore, can I ask the committee to agree to delegate authority to me as chair in consultation with party group lead members and Caroline Pigeon MBE AM to agree a letter to Transport for London requesting further information regarding Silvertown Tunnel?
Agreed.
Thank you very much. If I can then move on to item 5, action taken under delegated authority. In pages of your agenda of 81 to 156, can we note the actions taken by me as chair in consultation with party group members, including Caroline Pigeon MBEAM and the relevant committee chairs, to agree the actions listed in the report?
Agreed.
Thank you very much. And then can I move on to the excitingly entitled agenda item, COVID-19 Phase 1 and the GLA staff response. This part of the agenda is in 2 parts. We're going to look first at the work of the London-wide Strategic Coordination Group, which was an amalgamation of partners coming together to look out for the safety of Londoners during the initial pandemic. And then in the second part of this meeting, we're going to be joined by GLA members of staff to look at the specific contribution made by our own organisation to the coordinated response. So, can I then welcome our first guest for the first part? And I'm using your, apologies, I think I'm using your old titles, because I know you've got new titles, and maybe we'll come to that towards the end of the new titles that you have. But can I welcome our guest for the period that we talk about in question before we go on to the transition board and its new arrangements. Dr. Fiona Twyfrost, Deputy Mayor, Fire and Resilience, and this is the title that's changed, I think, the co-chair of the London Resilience Strategic Coordination Group. John Barradell, Chief Exec of the City of London Corporation and the co-chair of the Strategic Coordination Group, and Eleanor Kelly, Chief Exec of Southwark Council and co-chair of the Strategic Coordination Group. Look, we've set out three areas of questioning for you today. One is the initial setup and arrangements of how you saw the Strategic Coordination Group. And then we're going to pick up some issues of some responses back from the London boroughs and some key issues in there that emerged during that period of time. And then finally, we might talk about this last period of time of where you've moved into new arrangements, very timely in terms of the challenges we face around where they are, and we'll talk further about those. Would you like to make, or one of you like to make an opening statement, or would you prefer if I just went into our list of questions?
Happy to go into the list of questions if that works for you.
It does. Thank you very much. So this is really to all of you, and really it's about your reflections and roles really around this period of time. Can you tell us about the period leading up to March 2020 and the formation of the Strategic Coordination Group? When did preparations start? When were things starting to come together? So who wants to take that first question?
Fiona, do you want to? I don't mind, but if you want to start, and then I can always jump in after you.
I can do, but I think as with all things in our working relationship, let's do it as a collective effort, which is sort of the basis of the coordination approach. So like those of you on this meeting, the London Resilience Forum first became aware that there was a new virus that people were concerned about in China in January. If you remember, as early as the People's Question Time in January, the Mayor was asked about it. So this has been something that actually, even before we established an SCG, a Strategic Coordination Group, in March, the London Resilience Forum, which as you know, I chair on behalf of the Mayor, was doing a considerable amount of work, both in terms of looking at what was emerging as a risk, reviewing the framework for pandemic flu and seeing how we could translate it into a framework for COVID-19, which was done in time for the London Resilience Forum's meeting in early February, and that was based largely on the pandemic flu model. However, at the time, we had very little information about the new disease that was emerging on a worldwide basis, obviously, sort of first notably identified in Wuhan. So there was considerable work going on at that time. The LRF had a discussion about it at its meeting in early February. We established a small group where we were monitoring what was happening over February and early March. We had a number of meetings with Public Health England on an almost daily basis at points, several times a day, as we got towards the setting up of the Strategic Coordination Coordinating Group. and the Mayor held a Mayor's Advisory Group in early March, where it was decided that actually we needed to address the matter as a system-wide issue for London. And at that point, the Mayor invited John Barradell and Eleanor Kelly to act as co-chairs, which has been really crucial to the management of the process. And actually, I think at this point it would behove me to sort of say that I know I've said it before in meetings, we do owe Eleanor and John a debt of gratitude for everything they've done over the past few months. As you'll have noted from Eleanor's job title, and you'll be aware of John's role, we have borrowed a lot of their time from their already quite substantial roles. And I think we're very grateful. I'm very grateful personally. I know the Mayor's very grateful, as are our members, for everything they've done to lead the coordination. I'll probably hand over to John now just to talk about how he, as the principal chair, and I hope Eleanor doesn't mind saying, John's been the principal chair of the Strategic Coordination Group and the response. John can maybe talk us through how that process worked once we triggered the strategic coordination process and protocols in early March. So I'll hand over to you, John. Thank you.
Thanks, Fiona. I think I'd make 2 points, I think, Chair, if I can, and members, if I can. And I think I've said this before to the previous scrutiny, that what we were facing here in the early part of the year was very different to anything we've particularly exercised for in the past, or indeed we're expecting, in terms of most often when these incidents or these kind of events occur, you do have people readily available at your elbow who can coalesce around a table, you can pull resource into a place and get the right response together. And we had to engineer this arrangement virtually from scratch, where people had to be distant for very good reason, but we had to invent new processes, procedures and ways of working on the fly. And I think that probably presented one of our biggest challenges. Nonetheless, we'd identified, with the help of the London Fire Brigade, and thanks, I think, Fiona, to the team over in Union Street for their support in this, identified premises and identified facilities very quickly that we were able to show various key people around. That included members of government as well as the Mayor himself, to see the arrangements that were being put in place. So we had a basis, we had a battle rhythm, as they call it, horrendous phrase, but a way of working that made sure that information was being shared, decisions could be taken and logged, and that a regular set of works, meetings, sessions took place with the key partners involved. And the very early part of that work was not simply about how London would respond, how services were being managed, how the NHS, whether it required support or not, the various roles taking place in the coordination, but also trying to keep all of the stakeholders informed. So that would include Assembly group members, for an example, London members of Parliament, as well as the local council group leaders across London, really to try and make sure that everyone in the system of oversight and responsibility for oversight of public services in London was cited, could see and could comment on and challenge as the process took place. If I stop there, I think otherwise we'll get into a little bit of the weeds of this, Chair, and let obviously members drag and pull out questions and answers as they needed, unless of course Eleanor has anything she wants to add to that.
I would only add that I think it's sort of like important to recognise that there was a principal chair. I think that sort of like people look at a list of co-chairs and say, how can that possibly work? I think we have the advantage, John and I, of having worked together on a number of things, and being the chair and the vice chair of the lab. And we know how to play to our strengths, but also, given the scale of the work that was required, it's necessary to be able to do a division of labour and make sure that all of those things that John covered were able to be sort of like covered in the right way, and on a sort of like quite a repetitive basis in relation to the numbers of meetings and the numbers of engagements that had to take place over what has been and continues to be a protracted period of time. but I think is a very good reflection on London across all of the sectors, as to how people sort of like stepped up and engaged with that, and that is from the Assembly through the MPs, through the group leaders, through the chief executives, and through all of the leads across the NHS, the police, the fire brigade, the local authorities. I think it's a real testament to London's resilience and the processes that are in place.
And of course, you're dealing with a number of partners, a number of work streams, which I think you've already reported to the committee in the past. We might come back to you, but you're doing it in a basis of a very unclear legal framework. You're trying to reach consensus with people, but there's a bit of command and control because you're operating during an emergency. Can you just describe how those arrangements worked and where the higher authority clearly was government? I think that would be clear. But in a regional scenario, a London-wide scenario, there are, well, the police would have, their higher authority would be the Commissioner and the Home Secretary around those. Can you try to describe some of those complexities of how you manage that process? And we may ask you to write to us additionally about what the magnitude of some of those issues. Do you know what I mean? Who wants to deal with that?
If I can start, from my point of view, and I think I've said this before to you or to the Assembly, that clearly the relationship with government was key for this, because it was an extremely fast-moving set of circumstances, and COVID moved at speed, London being the first centre of population that had to face some of the issues. We had to make sure that arrangements that were put in place in London had the support of government, not only for funding reasons, but also, if you will, to provide the feedback into the government machine to allow them to understand the nuances of London, the complexity of London, London's communities, and the need for locality to be paramount. And what I mean by that is the different communities in London are very different. They have local leadership that needs to be respected, in my view, and also brought along with what was being done. The second thing to say, I think, from my perspective, is that there was clearly a point in time when things needed to move a little bit from consensus to we need to get on and do this. So whilst there are 33 local authority bodies plus the Greater London Authority and the Mayor, we do need to get to a degree of consensus and action. There isn't time for endless debate. There needs to be a bit of activity. So we did get government support for the SCG to be able to encourage, and it's no more than that, but encourage people to take action when it was needed. And that was very helpful, I think. It did cause, as you're aware, Chair, some friction at times, but I think in the end, people did understand the need for collective action to pool resources. And I think it is, as Eleanor said, a testament to public and private services, actually, and the private sector in London, when people did pull together, gave assistance to each other, and worked very closely with us and with government. And I think that's probably as far as I'd say. And of course, we'll get something back to you with a bit more detail on how that actually worked.
Okay, and just learning on about that period of time, there were a number of issues. I won't go into those now. We can detail those. They were in the press, whatever. We were slightly different complexity problems, but no different from some parts of the country in terms of some of those issues that were arising. So have you, as the Strategic Organisation Committee, done your own report, or did you rely on, or have you fed into, the June meeting of the London Resilience Forum? Where have you logged your work about what worked well, what didn't, what needs to improve, what could be done better? Do you know what I mean, in that sense? Have you done that yourselves as your group, or is that, do we need to look to the London Resilience Forum review? I understand there was a meeting in June regarding the first wave. Where do I need to look, and what can be shared with this committee?
So I think from my perspective, and Fiona may want to talk about the forum, the SCG itself did something, I believe, in early May, looking at lessons learned from within the partners, the various partners on the strategic coordinating group. And there were a number of lessons and areas for further work to be done in terms of if there were to be a second a need for a second strategic coordinating group at some point in the future, and that was fed in, I believe, into the LRF, but I didn't unfortunately attend that meeting as far as I remember in June, but Fiona can probably answer that one. But yes, there was lessons learned created, and that can certainly, the key elements of that can certainly be shared with the committee.
I'd add to that there was one exercise in terms of doing a piece on initial learning to completely distinguish between the SCG and the LRF is a false division, because actually a lot of the people who are at the SCG meetings are key partners at the LRF. But what we have done is divide it up into the piece of work that John mentioned, which was about sort of lessons learned for strategic coordination of COVID-19 and lessons learned in relation to the role and functioning of the London Resilience Forum, potentially with other sort of future incidents in mind. And we're happy to share those with the committee. There were 7 actions for the London Resilience Forum. These included scoping a number of ways in which it might be easier to manage an incident of long duration in the future. John mentioned that we were able to secure the premises at Union Street. We've got the ground floor of Union Street for the Strategic Coordination Centre, as I think members are aware. However, we don't have a permanent or even sort of call-off arrangement around what kind of facility. So one of these is scoping agreed facilities to host a Strategic Coordination Centre, bearing in mind, obviously, in this instance, we're likely to need space for some time going forward. How you manage to staff options for protracted incidents, shared IT and data transfer solutions across partners to be able to operate collectively more easily. Obviously, there's confidentiality issues around quite a lot of material that partners need to share, and options for dedicated comms teams, which are independent of any agency. So what we'll do as we go forward is those are being scoped at the moment for future discussion by the London Resilience Forum. But as a city and as a sort of system within the city, with responsibility for civil contingencies and preparedness, we do need to continue to review our collective response, both as we go through it, but also with a mind to what would enable us to operate more smoothly in the future. And I think it's really important to make sure that we are open to learning as we go through the process, not because there's a criticism of anybody individually, but we don't want to always have an all hands to a pump kind of approach to this sort of incident. We do need to sort of be as prepared and planned as possible in how we operate. But I'll leave it there for the moment, but we will make sure you get the information.
Okay, we might want to enter into a correspondence with you about some of the bits that you felt were missing, but that may come out in later questions. So I'll come back on that. But just I want to go back quickly to the responsibilities and accountability that you were working under. So in my mind, there are 3 probably golden shareholders in London. We could probably talk about more, but let's talk about the democracy bit. So we have, and they're not equal, let's be honest. So we have government at the top, and then we have the mayor, and then we have local government. And I think the mayor and local government is partly a different responsibilities, but they have a different weighting, I still believe, to be honest, around on that. So do you feel that you responded, that they all had a view about how things should be done, I would imagine? The trouble with local government, it would be 33 views. The trouble with the mayor, well, it would be his view. And then we got government with the views of government and the government departments. We shouldn't forget that in some ways. We talk of government being as one, but they're not. They are departments and they have different priorities and issues. So in terms of the priorities given to you as an SCG, do we think they were clear enough? It's a bit difficult because I have a political view on some of that clarity, but in terms of having to get on to carry out operational issues, do you think they were clear in terms of the priorities they gave you, whether you delivered them or in the context of what you had to do? because I think there were some impossible asks at some stage during that period of time, it seemed to me. It just couldn't be done in some ways. Can you just elaborate a little bit more about that?
I would put it slightly differently, Chair, if I can,
Yep.
needless to say, which is I think that there's a degree of autonomy, and there has to be, in the role of the Strategic Coordinating Group, because it represents not only the governance side or the governmental side of local, regional, national, but also other agencies who are fiercely independent, like the Met Police, for example. And the role of the group is simply to coordinate their activity, and its coordination is the key word in here rather than direction. And it is about coordinating the activity around a common goal, and it's the definition of the common goal that is critical up front. Now, the reality was that this was a health-led crisis, and the initial stage was, how do we provide support to the NHS, and how do we provide support to Londoners? And that support would be around several things. One would be making sure that the processes and systems in place to support the NHS were there. That could, for an example, and the Deputy Mayor may want to comment on the fire services support, for example, for ambulance driving. It was a key element of that. But it was trying to make sure that the various agencies worked together for the common purpose. The second one was to escalate to government and to embed government officials within the process so that they understood the nuances, the differences of London, and things that were being brought down to us were understood in terms of their impact on London and how the system works. The second thing I would say is that there was, in my view, a very good ability for us to influence back up the chain, to raise our issues in advance, allowing all the stakeholders, whether it be the local authorities, the chief executives, or the leaders through the group leaders system, for briefing back on issues that were of concern to the locality through the system. So I didn't feel that there was a degree of direction in that sense or prescription on what we had to do. I think that came from the members of the coordinating group itself and the definition of what our objective and outcome we were seeking was. And I don't know, Deputy Mayor, if you want to add anything to that, but that was my perception as chairing it. I didn't feel under obligation to anyone apart from Londoners, bluntly.
I think I think John summed it up well. I think the point about cooperative working, and I think I've spoken in different forums and maybe at the previous Oversight Committee about the role of the London Fire Brigades in relation to the ambulance driving, in relation to PMAR, in relation to a whole host of areas such as sort of distribution of PPE. That cooperative working was evident across the system, and I think that it's also about that sort of constant dialogue. So, for example, at a political level, at one point there were daily meetings between City Hall and the leaders of London councils. We still have those twice a week, and actually that constant dialogue, including, as John's identified, the embedding of government officials at the Strategic Coordination Centre, enabled that to be much more along the lines of discussion about what London needed rather than directive. And it was quite often the case that things were being fed back up in terms of urgent requirements as much as the other way. So I think I recognise the description John's had of that, but I think in terms of that constant dialogue, the constant dialogue between PHE and the NHS and the Mayor, between myself and the Mayor, other people in the Mayor, and the Mayor's Chief of Staff, John Barradell, and Number 10, for example, these are all really important mechanisms by which that communication and the sort of oils discussion were sort of kept going. So there was never a point during the early stage of the response where it felt like there was a massive disconnect between what was being required of the London system and what we felt at a sort of a strategic coordination group level was what we should be aiming at.
So how did the...
Can I just add?
Sorry, yeah.
Can I just add one thing?
Yes, please.
Thank you. Just add one thing in relation to stuff like, which is a bit of a historical context, which was before the review that was done some years ago by Lord Harris about is London resilient? And the answer was yes, but there were a number of recommendations. One of the recommendations was that other people other than senior people in the blue light services should be the chairs of the strategic coordination group, because it was recognised that there might be a circumstance where much broader skills, perhaps with more political acumen, would be required, and members of the people in the NHS, people in Public Health England, and chief executives of local authorities were identified as having a skill set that would help in this. And I think it's important to recognise that is, looking back, that was a really important point, because that's exactly what was required in this circumstance, where although it was a health-led issue, there were a whole raft of sectors across the public and private sectors that needed to be involved and needed to be coordinated, and that actually having that skill set beyond a blue light chair of an SCG was incredibly important. So I think that's actually quite an important historic point, that London was ready, because some years ago that point was recognised and was implemented in relation to training, and that we were actually ready to be able to do something as complicated and as far-reaching as this.
Of course, that's still an outstanding matter formally, I think. It's an important point you raise. I don't think we've ever had a mayoral response to that review. We need to follow up on that, and thank you for highlighting that particular report. So how did the mayor and his team, or deputy mayors in some cases, feed into yourselves about issues that they were concerned at? What was their role? How did that work? We might come back to you on others, but I think for the sake of time, if you could come back quickly on that to me.
Very quickly, Fiona and a couple of her staff were daily, literally 12, 14 hours a day, sitting 2 doors down in Union Street. So I think it's fair to say that concerns and issues raised from City Hall were straight into the meetings and straight on the table.
And that would be the same for government. There were daily meetings with government. Were you part of those daily meetings with government, or was that between City Hall and government?
I can only answer for the ones I was in, Chair,
Yeah.
but we had implants literally in Union Street at fairly senior level,
Yeah.
from government, who are still actually around and in the system, as it were. And there were, as Fiona said, regular phone contacts with government, senior government officials, to raise issues on London's behalf that were issues arising from the strategic coordinating group meetings. So ones that we felt needed escalation, there was a very clear and simple escalation route.
Okay, thank you. I'm now going to ask colleagues to come in. I think I've got Assembly Member Caroline Russell who wants to raise a question in this section or the next section.
I'm happy to leave it and just
Fine.
come in where you've
Are
got
there
me.
any other members who want to come in on this point to ask any questions that have been in relation to what we've discussed, or any new ones? Assembly Member Susan Hall.
Thank you, Chairman. Just a quick one, if I may. Can you tell me how many times the Mayor attended SCG meetings?
Sorry, John, I'll leave it to you to answer as chair. Sorry,
That's fine. There was, as Deputy Mayor said, the first piece was the Mayor's Advisory Group, which kicked it off. Thereafter, I frankly wouldn't expect the Mayor to attend the Strategic Coordinating Group meetings. They were detailed, and they were of a type where you would report the outcomes to the Mayor and there'd be asks back to the Mayor as opposed to participation. And I think it's an important distinction as we go forward, and it links back to a point the Chair made earlier about the distinction that's needed between the activity, I was going to call it operational, Assembly Member, but I don't, it's a little less than that, but where you do need the oversight, but not necessarily the interference, if I can be blunt about that.
No, I just wondered how many times. So he came to the first one, not the second. Has he actually attended all the London Transition Board meetings?
Yes.
Yes. Okay, yes. Thanks. I'll leave it at that, Chairman. Thank you.
Okay, shall we move on to our second set of questions, which is London Borough's feedback in some of the issues they've raised, but also I think we might be covering some issues that came up during that period of time. Can I ask Assembly Member Navin Shah to begin with a set of questions?
Thank you, Chair. My selection of questions are to Eleanor Kelly. What lessons have been learned from the response by the London boroughs? Eleanor.
What I would say is that London Council's Leaders Committee have actually commissioned a review into that very point, and that is underway at the moment. I think that there are lessons learned along the way, and those continuously get updated and improved in relation to both coordination and relationships and communication. And I think one of the key lessons is that although this was a health issue, in the first instance, the sub-regional groupings were set up around the footprints that we use for emergency planning, and that we've recognised that actually the sub-regional groupings for COVID particularly are much better placed to be set up around the health STP footprints, and so that's the arrangement that is in place under the transition management group. So I think the lessons learned have been learned moving along, and we have all local authorities have sort of like moved swiftly in terms of those lessons being learned. But I think it'd be very, very interesting to see the output when it's completed of the review that the London leaders have commissioned.
Elena, can you please ensure that we have that output information available to us when it's... any idea when you expect that to be available?
As I say, it was London councils that commissioned it. So I can certainly go back to John O'Brien and both ask him the time frame. I know that it is underway at the moment.
Yeah.
I can ask him the time frame, and we can certainly make that formal request to London councils. I'm sure it will be a public document once it's completed.
I would be grateful. It's just it's important piece of work, and it would be great to have it with us as soon as it's available. We can chase it up when we know when it's going to be available. Following on to that, can you tell us how prepared you think London boroughs are in terms of a potential second wave, if it were to happen?
The work is underway at present across all of those sub-regional activities in terms of second wave. If I sort of like speak just to my own sort of like sub-region in relation to South East London, we're actually involved this week in a big exercise involving all leaders and chief executives about preparation for outbreak control cross-borough. And that's reflected in the other sort of like sub-regions doing that work. And I think in relation to those lessons learned, as in terms of your first question, that is the point about being clear that this is not linear. Things cannot and do not contain themselves within borough boundaries. They will actually be cross-borough, and that we need fantastic cooperation across. We, as I'm sure sort of like John or Fiona can come into, we're much better prepared in relation to operationally and organisationally across all of the sectors, so around things like hospitals and around mortuaries and so forth, because of the learning from the first wave. But I think that sort of like the work that's been going on, both in boroughs and the responsibilities that they have, the new responsibilities that they have, they're taking that on board, and they're actually working much more cross-borough and much more cross-sector in each of those sub-regions. So I would be confident, I'm only one person, but I would be confident that the work is underway and the learning has been learned in relation to being ready for that second wave. What I would say is it's incredibly important to be clear about data, the availability of data and the availability of information. And I constantly repeat that we need, if the data is available, it ought to be shared, and it ought to be shared as widely as possible, because in this respect, data and information is incredibly important. The more people understand, the more likely they are to do what you ask them to do in relation to trying to get infection control in place. And we have much better data sharing across from Public Health England and from the NHS down into local authorities, down into sort of like local arrangements, so that we can, on a daily basis, be tracking what is going on in our neighbourhoods and be able to sort of like share that both within boroughs and across sub-regions, and be ready to address in as effective as way as possible if we can those outbreak control plans. So I do actually think that we are, particularly if a second wave is lower and slower, then we can actually sort of like stay on top of it much better. The first wave was so unpredictable, it was so steep, and nobody could ever know when it was going to sort of like stop rising. And thank goodness it did stop rising when it did. But with a lower and slower second wave, I think that London is incredibly well placed across all of its sectors and not just across local authorities.
Yeah, I mean, that sounds reassuring. Can I ask you, do you think that the boroughs are and will be well equipped, both in terms of resourcing, in terms of financial resources, which are plenty, to cope with extra pressures that local authorities have, as well as specialist items like PPE, etc., procurement of that, or having the right level of those resources available? Do you think that we are ready for any such call that we may have if there was a second wave?
To be honest, I don't think I'm the right person to ask that question. I would say, as the Chief Executive of London Borough, no, the financial situation is incredibly precarious for everybody across London. And I think your question is probably a question best put either to the Chair of London Councils or to perhaps the sort of like the lead, the finance lead Chief Executive. Either under the Chief Executive's London Committee. I think that the financial situation is incredibly difficult, and I think that, but I would say that within the resources that we have available, the issues, the operational and strategic issues around things like PPE and managing mortality management and so forth are as well managed as they can possibly be at the moment. But in a resilience sense, it's not just COVID. There are a number of challenges facing London boroughs, facing the NHS, facing Public Health England and its successor body, facing the police, and we just cannot be complacent. But that is much more of a personal and sort of like professional from one borough's sort of like perspective, as much as it is as the co-chair of the SCG.
Yeah, moving on to my last question. The feedback that London Assembly has received from local authorities would suggest that communication between local government and national government could have been better during the initial response. As we move into the next phase of our response, in which the role of the local directors of public health takes an increased importance, have the communications between local authorities, national government and the London Transit Board improved?
I think that's the question for John.
Yeah, I was going to say, Eleanor will have a view, I think, from a borough point of view, I guess. With that, my sense is yes. I think the early days of this were quite difficult because, as Eleanor said, no one knew quite how this was going to play out. Certainly in terms of the degree of infection, the ability of the NHS to continue to cope bluntly with the volume, and we saw that with the building of Nightingale at the Excel Centre, for an example, and the need to build that at pace. And also, frankly, the expectation of local authorities to continue to provide services beyond the shielding of vulnerable people and what we called the core services. And a mistake I made early on was to ask the boroughs whether they thought their critical services were at risk. Now, what I didn't do was properly define what I meant by that. And there were a variety of different interpretations put on it that caused me chaos afterwards, which was my fault. And what I was trying to get to was an understanding from a system point of view of whether the councils, the local authorities and other partners could keep their basic services running if you were to shut down the town halls, the offices, the transport system were to shut, what would that impact be, to be able to give reassurance to the mayor and back up to government as to what the situation in London would likely be. So there's a lesson there, back to the chair's earlier point about language. It's always my problem, actually. You've got to define the language really carefully, otherwise people make an assumption of what you're actually asking for. So a very early lesson was that one. I think once we got through that, and once we got through the local authorities organising themselves sub-regionally and identifying one of the chiefs as being their lead person, the communication became a lot better. It settled down, people knew the personalities involved and knew what their strengths, weaknesses were, how best to get engagement from them, and the system worked far better. But I would go back to, this was being done at pace with something that was not known, the first in the country to do that, with a local government system in London that to say is complex is an understatement, okay, with remote working over electronics, all at the same time.
I'd simply like to make a comment and probably stop there. As someone representing, well, I represent Harrow and Brent boroughs, okay, as my constituency. And I know for sure that we had a lot of concerns during the early stages of pandemic, that we didn't know what to expect from the government. You know, that there was this constant problem of what do we do in certain circumstances, what the local authorities do, what to expect from government. And that was really not acceptable. You know, that was pretty damning sort of situation. Can you, I mean, from your experience, from your position, are you sure that that relationship, that situation has improved, and that communication is now what it should be to deal with such a serious situation?
So I think the difference I can tell you, Assembly Member, is that the Chief Executive of Brent is now the lead Chief Executive for the Northwestern sub-region. She is not someone who is backward in coming forward, and I'm sure if there is an issue that is of concern to Brent, she is a member of the transition group. I hope to speak to her this afternoon at the next transition group meeting, and I'd expect her to be raising concerns direct with the government representatives in the room. So there is a mechanism for them to do that, and there has been a mechanism for them to do that from the beginning. I think the challenge, as the Deputy Mayor said, was partly the expectation of government was not known, and I think local government were waiting, in some cases, were waiting to be told. Other boroughs decided to do what they thought was best and get on with it. Some were waiting to be told, and I think that's where you saw a degree of inconsistency, which is what we then had to try and grip to say, this is what you need to think about.
Now, I've seen Assembly Member Amesh Desai. Is it on this point? This point?
Yes, Chair, I think it continues.
Yes, good,
and if I could come in, thank you for letting me in before Assembly Member Pigeon.
Yeah.
Eleanor, you very rightly talked about the need to work across municipal boundaries. Of course, the virus does not recognize municipal boundaries, and we've got to think at a wider level. And I note with interest what you just said, John, about local authorities organizing sub-regionally, and if I understood you correctly, the enhanced role of, you mentioned the Chief Executive Brent. Now, let me tell you, I want to ask you this question. It's in the context of what lessons have been learned from the response by the London boroughs in the first wave, and preparing for a potential second wave. What has concerned me greatly, in taking East London as an example, and I've raised this question at health committee meetings, in the local media, and have written to the Director of Public Health of one of the boroughs I represent. So in terms of East London, you've got Tower Hamlets, Newham, Barking and Dagenham, and of course I also represent the City of London. But there are London-wide issues here, and I'm not being parochial. In Newham in March, we were told things were okay. By the end of April, Newham had sadly shot to the top of the league in terms of reported cases and the number of deaths. The death rates in Newham equal that of Barking and Dagenham and Tower Hamlets. Boroughs with the same characteristics, same demographics, same issues, lack of resources, and so on. And I just want to know exactly, is there an explanation for this? The response I've had so far from the Director of Public Health for Newham, the health committee of the GLA from the London Public Health Director it's about resourcing. We are looking into this. But it concerns me. It's a question I've been asking for some time, and I will continue asking, because we got to learn all the lessons from the first wave if we are to genuinely prepare properly for the second wave. Why is it? How can, if any of you can explain, I know that you don't have a medical background in that sense, but what has gone wrong in terms of the disproportionality in cases reported in deaths in one part of East London, when the picture in the other two boroughs is completely different?
I'll move off. You're right, I don't have a medical qualification, and that's one of the things that the London Director of Public Health, Evan Fenton, who I think is the Mayor's advisor on public health as well, is certainly concerned about and has done some work on. I think it suffice it to say that the immediate lessons, particularly in terms of communication, particularly in terms of understanding the need, as Eleanor talked earlier about the more information given to the public and to community groups, that can go straight out to change and encourage the change of behaviour. And you're seeing that, by the way, in Tower Hamlets at the moment with some work with Muslim communities, for an example, specifically targeting the change of behaviour for younger people to understand the need to protect and help older people in the community from being infected. So boroughs understand their communities best. We have ward level data now published on the national website to assist with this, and to allow local people, and I think I said this before, Chair, to one of your previous scrutinies, about local politicians are the best placed people in some cases to go out to their communities and encourage change as local leaders. And that may be what sits at the root of your question, Assemblyman.
Hold on, I think Fiona Twycross wants to come in and respond. Fiona?
Thank you, Chair. Yes, I think that the questions around disproportionality and what we knew about the disease when it first emerged and what we know about it now do really sort of stand at the heart of how we need to prepare for the second wave. And I know Eleanor as well has done a lot in terms of highlighting issues around people with learning disabilities and complex needs, and sort of looking at sort of those particular groups which have also got massive disproportionality. This is something that I think it would benefit the committee to talk to PHE about. What I have observed, though, in some of the recent meetings of the Transition Management Group is very much this thing about sort of community level communications and making sure communications are appropriate in the right language and provided by people who understand those communities. So as well as local boroughs undertaking quite a lot of bespoke work using specific language and with an understanding of the communities they serve. Just to note that obviously the Mayor raised issues around disproportionality very early on before it was looked into at national level, and has subsequently undertaken a lot of work through teams at the GLA working with PHE on looking at what can be done to address disproportionality. And this includes the Mayor creating a series of videos in Urdu, Punjabi, Bengali and Hindi, which encourage the use of face coverings, observing social distancing, regular hand washing, which is obviously sort of still core to the public health messages that we'll continue to see coming out from central government over the next few days as we sort of enter this new range of measures the government announced last night.
Thank you.
If I may finish just
very quickly
with more of a comment than a question. I welcome what the Mayor is doing about getting the message out in different languages. That's fantastic. And John, I think you are, in my opinion anyway, you are touching on some of the issues that I think underpin the differences. Messaging that is important. The Director of Public Health from Tower Hamlets was very good at our committee. Talked about Tower Hamlets communicators. I think it's also to do with issues like enforcement, overcrowding, how councils run their private sector licensing schemes. Councils like Bark and Dagenham have got very robust enforcement measures in action with a great philosophy. And I think that could start explaining some of the difference, some of the variations in reported cases and deaths.
Okay, we're going to move on to the next set of questions from Assembly Member Caroline Pidgeon.
Yeah, could I just ask, maybe start with Eleanor, what are the London Transition Management Group and the London Transition Board doing to ensure the views of London boroughs are properly reflected as part of the ongoing response to COVID-19?
I think it's actually a question for John, but particularly on the transition management group, the London boroughs are very well represented, as John said earlier, in relation to being able to sort of like feed in directly, both into the transition management group, but also with the group leaders being on the transition management board. But I pass that question to John.
The short answer is I think they are well represented. The meeting this afternoon has a specific item for each of the sub-regional chiefs to update issues they want to raise back up the system, as it were, through to government who sit on the calls. So, and that has always been the case. The original way it was set up didn't work as well because it was reliant upon one individual to represent all of London local government on a daily basis. That had to change, and that changed with the transition group. The Transition Board, which is the oversight, has the group leaders from London councils represented on it, chaired by the Mayor of London, excuse me, and the Chair of London councils as well. So politically, yes, and also officer-wise on the transition group itself.
And the sub-regions are, you believe, a much stronger way to make sure you get feedback up from those boroughs, but also out.
Yes, and I think there is, from my perspective, the real value of the twice-weekly meetings or the twice-weekly conference calls with the group leaders from London councils, bluntly, because dealing with 33 leaders would be quite a challenge for me in a day job. Trying to do it on top of the other stuff we're doing, having the group leaders able to do it makes it an awful lot easier for us to get the message straight out using the channels that exist.
Lovely. I think
yeah.
Go on, Fiona.
Sorry, if I could add that Zena Etheridge, who is the lead chief exec for the boroughs, also sits on Transition Management Board. So it's both the political leads and the officer level lead who sit at that level to make sure the views of boroughs are represented.
Lovely. I think that answers my questions. Thank you, Chair.
Can I bring in Assembly Member Joanne Mccartney?
Just a quick question. It was on something that John mentioned earlier, that the initial response, I think, John, you said that some local authorities got on and did, and some waited for government instructions. Can I just check that moving forward, is there a clear expectation now about a uniform response across our local authorities?
Short answer is yes, because the risk I can see personally at the strategic level is it's not a postcode lottery, but it goes back to the earlier question about why is it different in one borough to another, and trying to get a degree of coordination and consistency across the system. And that's not only geography, that's also agency as well, to make sure it's one message, one set of activity. It's quite...
Okay, now I'm going to go back to Assembly Member Umesh Desai for two questions, I think, I believe. Yep.
Yes, Chair. And I'm bearing in mind the time as well. To the panel, what have been the key challenges posed by the easing of lockdown restrictions? So it's to all of you. I mean, I don't know who wants to start. Fiona?
I can start if that's helpful. I think that people were very clear what the rules of the game were until lockdown started to ease. And then I think that because there were so many different things that could or couldn't happen in various points, and people didn't necessarily quite understand the rationale as to why they could do one thing but they couldn't do another, it became far more complex. For example, people didn't understand why you could play golf or have a garden around but you couldn't go and visit your family and so forth. So I think that got really complicated, and I think that part of what the government appears to be trying to achieve through the clarity that's been given overnight is to start simplifying the message back down, which I think, hard as the message might be, is actually potentially very helpful.
Anyone else? Or
from my perspective, I think one of the, and this is moving into the transition management group and board, is the very clear piece from the business sector about the impact on business that didn't come at the early stage. Clearly, the early stage was really around the medical side and the pandemic and the lockdown. What's become very apparent is the effect on London economy, and therefore the balance between the two sides, and that is different, and that's developed over time.
And if I can add on that point, it's about making sort of in the approach we take, trying to make sure we don't set economy up against health, but you get an integrated approach whereby we can be as economically active as possible while maintaining sort of the principles around being COVID safe. And I think at some point, I'm sure you'll have Kevin Fenton from PHE talking to you, but he talks very much and very coherently about how we need to learn how to live with COVID, because COVID's going to be here for some time. And we have to do that living with COVID bit, and that means being COVID safe, but it also means sort of trying to get life back to as normal as possible, albeit for most of us it doesn't feel particularly normal as it stands.
Just a point that I would note, again, clearly local authorities, I would put you, have got a very important role to play in making sure that whatever lockdown restrictions there are observed. So to use the example of Bark and Dagenham again, just for the last few days they've closed down 2 establishments for people actually not observing restrictions, wearing of face masks and so on. I mean, is there a way of sharing good practice? Because there is some uneven, there is an uneven approach I've noticed between authorities that I actually monitor and observe.
Yeah, I think there is on several levels. I think some remember. One is clearly in terms of the sub-regions, and they do meet and they do exchange good practice. There are also some boroughs who are leading on some of the work strands, one particularly around this. There's also the professional networks of things like LEDNet, which bring together the environmental health officers from the boroughs, which is one of the professions, as it were, within local government that would be specifically looking at the premises management side. And there are also other initiatives being taken on a London level. For an example, a COVID scheme which has almost the scores on the doors, which allows businesses to go through a COVID checklist and then environmental health to back them up in terms of saying we are ready and we are taking the right precautions within our own premise. And Southwark, the city, and Camden are participating in a pilot for that, which again is designed to get a degree of uniformity across the system and across businesses. So you're absolutely right. Various means are being used to do exactly that.
Sure. Chip, I'll move to my second question, but I must say, John, I do like, there's merit in what you said about having a sub-regional sort of approach. And that's something that for me has come out very strongly from the session so far, and for us to think about. My second and last question, Chair, is when did it become apparent that the challenge had changed from deaths in hospitals to social care settings, and what did you do about it?
I think that became clear as it became a national story, to be honest with you, as the numbers coming through the system and the hospital admissions started to increase. And it really is one for health. And it is one better directed, to be honest with you, at the NHS and to Public Health England representatives. It's something that we would have seen and did see as part of the coordinating group, and did ask comment from colleagues in health. But we don't take, and be really clear, we don't take responsibility for agencies. What we're trying to do is coordinate the response so that the information flows between them and that they coordinate their activity for the benefit of Londoners. But it was certainly raised as a concern. The data started to show an increase in deaths in care homes, and it was raised at the SCG and passed through to the NHS and Public Health England to pick up and deal with.
Just to be clear, John, in my own mind, the bit that was passed to the NHS was about PPE equipment coming down, because they were the main distributors of that, wasn't it? Between local government, some
yes.
Local government went into their private market to get their own. But the real problem in London is we have a disparity between boroughs. Some boroughs have got 200 odd old people's homes, isn't it? Maybe an exaggeration, and some have got 12.
Yes.
And that is a big task for local government to divert and support a strategic sector that was under stress, if that's the right word.
I think that's very fair. Yeah. And I think the consequence of that, if I can, Chair, is that clearly the mortality that we saw was disproportionate in some boroughs to others, given the demographics and given the care homes. And I think that then caused us to go back to work through what that then meant in terms of mortality management and how that played out in terms of the boroughs and their responsibilities. The lead for that piece of work is Paul Nashorak, who's the chief executive from Harrow, I believe, and he leads for that for the London adults. I'm wrong, aren't I? Is it Ealing? I'm sorry, I knew
Ealing.
I was
Yeah.
It's out west somewhere.
He was Harrow before, now he's Ealing. Yeah.
So he leads for the Association of Directors of Adult Social Services, and Paul is currently working with Public Health England on exactly this. And he would be useful maybe for the committee to hear from in due course.
I think there are a number of things we might want to pick up in terms of who we go back to and best directed to, and to see how they did with some of those issues, because they were clearly key, and you've obviously taken some of those lessons on to. We shouldn't see a repeat. It shouldn't be a surprise.
Right.
The threat is clear. The need is clear of what we need to do and how we can minimise that threat, and actions can be taken. But it does require different people to play their part. Is that correct? Okay, right.
Yeah.
Amesha, you finished. I'm sorry, Catherine. Is that okay?
That's fine. Yeah.
Thank you. I'm now going to go to Assembly Member Caroline Russell for some questions.
Thank you, Chair. Yes, I want to pick up on something that has been touched on briefly earlier, but how has London responded to the mental health and well-being issues arising from the easing of lockdown restrictions? And that's to all three of you, really. I'm not sure who in your teamwork approach to things would be the best to pick that.
I can start. So I think so research from PHE, Thrive London and the Centre for Mental Health has shown, as you'll be aware, that the situation created by COVID-19 has increased poor mental health and psychological distress across London. So we know that there's been a widening of mental health inequalities and that groups that had the poorest mental health before the crisis have had the largest deterioration in mental health during lockdown. So, for example, research has identified specific groups of people facing high risks, including people with existing mental health or physical health conditions, older Londoners who might be isolated, BAME Londoners, young Londoners from aged 18 to 24, particularly where they are unemployed, pregnant women and single parents, LGBTQ plus Londoners, children and young people, particularly those from low-income families, from BAME backgrounds and young carers, and those bereaved by COVID. So you can see already that actually there's a huge number of people just by that list in terms of people who are affected. This is another thing that obviously the Mayor has responsibilities for health inequalities and mental health, and the stigma around mental health in particular fall into this. So the Mayor has done quite a lot to support Londoners during this time, and actually one of the things that I think he did quite powerfully was to talk about the impact of the pandemic on his own mental health, and he's led discussions and has met regularly with London's mental health leaders and launched a mental health action plan to respond to the rise in mental health. But this is also something that I think it would benefit this committee to talk to PHE about as well.
Okay.
Thank you. This is a related question, but I don't know if you've got any more that you'd like to add, just on addressing the adverse impacts of continued home working and also the lack of social contact for these vulnerable groups. And I'm thinking in particular of sort of young adults with learning disabilities, some of the groups that have been, weren't picked up in the sort of immediate impact of addressing the pandemic.
I think that it's a difficult call, isn't it? Because you've got to get the balance right. And I think while some people have welcomed the opportunity to work from home, obviously for a lot of people, getting back to the office is a blessed relief. That counts for people with mental health issues, obviously people who are suffering from domestic abuse. It's also sort of not a refuge to necessarily spend more time at home. So I think all of these things come into play when you start talking about when people go back to the office or other workplaces and how that's managed. I think quite a lot of these issues will be played out through the work on mental health that's being done through the recovery strand of work as well. So that's something else that the committee might like to look into. But I think that the range of people who are affected adversely because of the hugely abnormal situation, it touches pretty much everybody in some ways. There'd be very few people who could honestly, hand on heart, say that they haven't been adversely affected in some way by the pandemic at various stages. So I think it's about making sure that everybody's aware of that and actually particularly mindful about those people who might be working with them and basically articulate the issues that while it's easy for us to say it's great working at home, and I think for many of us it has worked well, for many others and at various points it doesn't work, and that increased sense of isolation where you've got younger people who basically sleep in a room, have been working in a room, have been socialising online in a room for many months. I think it's really important for us to promote the risks that poses for those individuals, both in how we talk about the pandemic and the sort of pros and cons of home working versus coming back to the office, but also in terms of how we set policies and look at what recovery looks like going forward.
Yeah. Thank you.
Okay, I want to bring in now Assembly Member Susan Hall.
Thank you. It's just a quick one, really. I think this is for John, if possible. I believe there's an issue regarding payment, or was, for the temporary mortuary services used during the first wave. If, please God, we don't, but if we do get a second wave, what have you got in place to deal with a possible situation around that?
So the provision of mortuary capacity is the responsibility of local government, the local councils. And there is, Westminster City Council have made proposals to the other boroughs to take responsibility for mortality management. I think it's fair to say that it is not simply a case of public mortuaries or excess death mortuaries, if we put it that way. It's also the entire system of private funeral directors, NHS mortuaries, as well as public ordinary, existing public mortuaries. So yes, there are plans in place and ready. If we had to, we could stand those mortuaries up straight away. Bluntly, we do that and sort out the financials later. It's more important to get this right for families to treat if there were deceased people with respect and so on. And personally, it's and I shouldn't say this in a public forum, it's a second order issue to get the finances resolved. We have to get the solution done first, but there are plans and progress is being made to make sure that those plans are robust if there were to be a second wave.
Okay, thanks very much. And thank you for taking some of us around the facilities you've got recently. That was very interesting and amazing how well it was working. So thank you very much.
Now, just before we go into the final section, we've just got about six questions on the final section. There were a couple of issues and a couple of points I want us to pick up. We will be writing back to you, but I'm aware the next 8 to 12 weeks are going to be pretty crucial time, I suspect. So do not think you have to rush back and respond, right? So, but we get a letter off to you about some of the issues that have come up in this session, including issues, and I know they are matters for policing, but I think they have a direct bearing on the next 8 to 12 weeks, the issue of enforcement. Or lack of enforcement, as maybe others have observed over that initial period. Mixed messages given at different times around issues. Of course there are warnings, no one expects that, But we've now got a set of circumstances where everyone should be fully aware of their responsibilities to not only their family members but to others. So in that issues, we'll write further on enforcement, but let's move into where we are now and moving into this next phase of work and the capacity or the organisation that we've got to take us forward over this challenging period of time. I'm going to ask Assembly Member Onka Sahota to lead the questions.
Chair, thank you very much. These questions relate to the disbanding of the Strategic Coordination Group and the establishment of the London Transition Management Group. First of all, who made the decision to change the governance arrangements for London's response to COVID-19?
I think it's probably me making a recommendation to the Mayor that the Strategic Coordinating Group had reached the end of its usefulness, bluntly, as the curve started to decline and a number of issues started to become permanent fixtures on the agenda, like, for an example, how do we get business back in? What does transport look like? How is a health service going to cope with the backlog and so on? And if the issues that bluntly are not about response in that sense, there needed to be a different mechanism, and the Secretary of State and the Mayor decided that a transition group would be, and a transition board would be the way to do that, and also allow us to involve people from different sectors. So, for an example, the business sector represented by London First, by City UK and by New West End Company, who were directly affected, along with Transport for London, along with CVS, for an example. Yeah. So it was a decision of natural end, if I'm honest.
I mean, you may have already partially answered this question, but the new arrangements, how will they better prepare us now from now onward, and particularly if there's another second wave upsurge?
My experience over 20 odd years, and Eleanor's for as long, I think, if not a bit longer, on looking at events like this, is that a key reason why you are able to manage things well is knowledge of the individuals that you're working with. So you know the individual's strengths and weaknesses, and you build a very strong professional relationship with them. And I think the benefit of the Transition Management Group is we've kept together that expertise around COVID and how London works. And that's going to be important going forward to some other events that may be on the horizon as well. And that then allows us to step very quickly back into, if I call it operational mode, should we need to do so. And having agreed a set of criteria that are reviewed every week to know when we're likely to need to go back into a different arrangement.
Great. Thank you, John. That's what I wanted to ask the Chair.
Okay, if we can then move on to Assembly Member Caroline Russell.
Yes, I just want to know, how will the work of the Transition Board strategy groups differ from the work streams that were identified under the SCG, or will they differ?
They were initiated from the SCG. They've developed over time. So for an example would be Sir David Sloman looking after the health subgroup, for an example. David would not have got involved in the Strategic Coordinator Group, bluntly. He's far too strategic, if I'm honest. Whereas he would when it comes to the health system in London and its need to recover, as it were, short term from the initial COVID piece. So it started with that and continues. And in fact, in today's agenda for the transition group, I think, Fiona, we've got a set of items from those working groups underneath the group, as it were, to flag issues they want to raise back to the board. So we're starting to move from, as it were, the response piece back into those groups.
Thank you. And who is now making the ultimate decisions on London's response to COVID-19?
Deputy Mayor.
I think there's an element of consensus which I think is missing from the direction of some of the questions, not just this question but earlier. We have to have consensus around some of the key decisions we have, and one of the reasons for continuing once we ended the SCG and started with the Transition Management Group and Management Board one of the reasons we wanted to have things in place of this nature was to make sure that as far as possible, and obviously it's not always possible to make consensus, and to some extent we need to agree that there are points at which we're going to disagree, as far as possible everybody needs their voice heard, and as far as possible we should get consensus, which is why as John mentioned, you get sort of key representatives of business who wouldn't normally be in that sort of space in terms of the broader resilience response. You get every single level of government. You get the mayor and the secretary of state and the chair of London Council chairing the key groupings, so that you make sure that you get that dialogue at every single level, and you can get consensus within the system, if you like.
Mm-hmm. Thank you.
Can I come back on that point? I think I've listened carefully to that, and it goes back to the very conversation that we had earlier on in the first part. We talked about responsibilities, isn't it? And I think I'm right. I think democracy matters in a democratic issue, and politicians matter around that. But I think John's also right. In times of crisis, officers should take the appropriate role, and the politicians should be very clear about the commissioning of issues, but allow you to get on to do what you need to do to protect people. So, but coming back on that, the whole thing about the transitional board, it is clear to me by the issue of the co-chairs, is that politicians are much more clearer involved in that direction of travel of the strategic coordination group than maybe before. Now, I think there's a question of it's more transparent, and I quite like that in some ways, rather than I think they were always influencing your work on the strategic coordination group, but not in a less transparent way. So I think there are some issues there, but this idea there's not, and I'm not suggesting you did, Fiona, suggest this, but there is an hierarchy. There is an hierarchy, and at the end of the day, someone has got to take the decision. I think some of our enforcement decisions in the past have not been coherent or clear, which is going to lead to a lot of problems, I think, in this next stage, where enforcement decisions need to be clearer. And I think that's what government is trying to do with its announcement yesterday. I think it's a difficult one because of the mixed messages we've given in the earlier stages. We've not been consistent. I think these are all going to be tested, aren't they, in the coming 12 weeks, I think, depending on the way COVID-19 develops in London and across the rest of the country. And I think that's going to be one of the challenging bits, isn't it? And what we do is we've got to get the governance responsibilities right with the operational responsibilities and allow professionals to do what they do. Politicians are important, but actually at the fore, but equally, I think we politicians need to give clearer messages. And I think at all levels, both regional government and at local government level, sometimes we've not been that clear. And I think we can all put the blame on each other, but I think consistently there could be some blame on each part of our elements about being very clear and consistent about what's required and what isn't required. But, you know, we live in a democratic society. It's not easy, but there is a time when, you know, we need to be a little bit more forceful about the asks that we're trying to do when we're trying to save people's lives or to try to contain this virus. Sorry, Caroline, had you finished or is there more?
I'm done.
Thank you very much. I'm now going to move on to Assembly Member Joanne Mccartney.
Thank you. And looking at the London Transition Management Group, can I just ask, perhaps this is for John to start with, how will that group respond adequately and perhaps even more robustly in the face of a second wave in which excess deaths may occur? You know, as I suppose it's a question, have you learnt the lessons and what's going to change?
So I think I'd hope I'd be expected to say the answer is yes, wouldn't I? But I think there is a bit more substance to that, in the sense that we have, as we said earlier, got the sub-regional representation on there directly with the boroughs. They've got individual leads for particular strands of work. And we're starting now from a position where the streets are completely empty and we've got no staff we can call upon. And I think they're materially different. And we've also now understand a little bit more how the health system is functioning, who is doing what to who. And we have an intelligence cell who produce a weekly, commonly recognised information picture called a CRIP. But basically it's pulling together all of the information, the risks that individual agencies and themes are seeing in their work, where they're red, amber, green, where they're RAG rated effectively. So, and also a timetable of events that are happening to start giving us, if you will, a horizon scan of issues that may become important for that group to look at. So all of that preparation is ongoing. It's not standing down. I would not recommend to the Mayor or the Secretary of State that we stop that for a while yet. And if anything, the tempo of that may increase over the next few weeks from being a weekly to somewhat more frequent meeting, albeit virtual or physical.
Okay, obviously local authorities who were delivering a lot of this work on the ground pulled in staff from elsewhere, and local authorities are starting to get back to business as usual. Do they actually have the resources and bandwidth to deliver what they need to deliver for statutory functions, but also in the case of a second wave?
I'd expect one of the areas that we have asked for work on is the risk around maintenance of core services within local government. And that's not only local government, that's things like, for example, the care sector and so on. And it does get flagged as a risk if there is a second wave of the resourcing for some of those core areas, yes. But that is, again, one better directed at local government.
Okay, fine. And then you've talked a lot throughout about partnership working, and this has obviously been a great exercise in partnership working, not only with organisational stakeholders, but also with the voluntary sector as well. I suppose moving forward, do you think there are any silos still to be broken down where that partnership work can improve?
Yes, there are. And one of the things I would be pushing for is a better understanding and involvement of faith sector and voluntary community sector in this. I think there are huge lessons for us in terms of the faith sector and how that probably was, I don't mean underused, but under-involved, particularly given, again, back to an earlier question, the benefit of having very direct involvement with some parts of the faith sector into communities that at first sight may have made a difference to infection.
Okay, that's helpful. And then obviously my role as Deputy Mayor for Education, I'm aware of some of this work, but if you could speak perhaps a bit broader. But I think you've said that the work of the strategy groups has now started under this new management structure. But has all the strategic coordinating groups work streams been disbanded? And how is the management group planning to maintain that immediate response role whilst also focusing on the long-term recovery? I know there's a recovery board, but there is going to be some crossover between the two. So how are you dealing with that?
So I think in terms of the ability to step back up with one of the conversations this afternoon, actually, Fiona, I think in our meeting, is we have the core group anyway that would form the nucleus of a strategic coordinator group should it be required. There's clearly work also going on in terms of what would a step up look like in London should the numbers start to move very adversely in the wrong direction, and how would that work, and how would you maintain, and it's back to the Chair's point around the political oversight and the responsibility for that. In terms of the longer term work, which is the one I think you're talking about, Peter John leads on the education subgroup, as you're aware, and that work would continue regardless, in truth. And it is almost, in my mind, the work programme may change depending on circumstance, but what's been brought together are the key influencers and, if I can use the word small t, talent in that sense, around education as a restart function that can be kicked off a second, third, fourth time. So once you create the group, it is always best if it has work to do to keep it going, because there will be new things that arise over time.
And broadening it out, that is the case for all your work streams?
It is. Yes.
Okay, yeah.
Yes.
And so, and my point about issues that the transition group, management group or the transition board might consider are also going to be relevant to the recovery.
Yes.
Because some of these pieces of work will run from your group into the recovery board. So are those links well established?
I think by dint of two things. One is the support from the GLA and agencies within the authority itself, providing secretariat and support for both groups. Common membership, bluntly, of the recovery board and the transition board itself. And I think a willingness that you can't keep doing response forever. Eleanor and I and Fiona are based on Duracell batteries, and at some point we do need to, either be replaced or be recharged, I guess. So I think there is a piece here about at the relevant points of handover, when it ceases to become a response piece to now long-term 6, 12, 18, 24 months, and what's the future of London look like, which is not to do, I'm the worst person to ask about that.
Okay, thank you. So could I take it that your work streams are flexible and they may well change?
By definition, which people get infuriated about, but they have to be. Because
thank you.
Okay,
Thanks,
so
Chair.
I now need just to bring in Assembly Member Andrew Brough, and he's going to ask a question that relates to an earlier section, and I apologise because I missed him off my list. So, Assembly Member Andrew Brough.
That's all right, Chair. Thank you very much. I apologise because there was some confusion over order of questions earlier, and perhaps this should have been earlier. The other day, I went into, I thought I'd go into Barking and had a cup of coffee on a pavement cafe, and it was like staring at a petri dish. It was as though none of the messaging had worked at all. People were shaking hands with vague acquaintances. People were coughing in the street. There was generally, you would have believed that we were actually in February rather than where we are today, having experienced the pandemic. And as I looked around, and this was very near to Barking Town Hall, there was a number of advertising hoardings that were completely empty. And it made me wonder what on earth is being done about coordinating the messaging, not just between boroughs, but between the public themselves. Because, as was alluded to earlier by the Deputy Mayor, some people find some of the messaging a little difficult to follow. So what role will the Transition Board have in ensuring that we have a coordinated message?
So we have a secondee, or a person rather funded, is probably more accurate, by government to assist in pulling together a communications work stream. And there is work to be done to make sure that there's consistency. One of the messages we've had loud and clear from business, from councils, right the way through to the mayor and government is we have to have a single message. We can't have different messages in different places. There's got to be a simple, straightforward line. And I think that comes particularly from business, if I'm honest, Assembly Member. Fiona may, the Deputy Mayor may talk to the work of the GLA and the Mayor's office here, but London councils have also been doing some coordinating work. The risk with that is it becomes local and isn't a single communication message. So you're constantly in that balance between the two. Your point about empty advertising hoards is one I'll make a note of, and we'll challenge that this afternoon with sub-regional colleagues about the use of empty spaces. And it's certainly one we have asked TfL to look at as well, to make sure that, as the numbers start returning onto public transport, we use that opportunity as well to get messaging across.
Can I just check with all Assembly members, are there any further questions that need to be asked? Then at this point, can I thank all three of you? Look, I can't thank you enough for the work that you do, but I know there's an old number of people from both public and private sector trying to help make sure that we are safe during this pandemic and minimising the risk. And I hope that during the meetings that you can convey that, and I think, the chair of the Assembly's here, but I think it would be from all Assembly members, thanking you for your work in that past phase, but also knowing that you face a difficult challenge in the coming weeks, months as well. And we want you to do well in that. We wish you well, because that's important to us in terms of safety of Londoners. But thank you for the work that you do, and please pass it on to other colleagues if you can on our behalf. You can now leave this session. We'll come back to you. I'll try and make that email to you as gentle as possible in our requests. But as I said, we're not expecting an immediate response from yourselves. But thank you very much for the way you answered our questions today. Now can we move to the next panel that we've got? This is where we focus on the actual GLA contribution to not just the strategic organising team, but for COVID work in general. But I think it is about the contribution they made to the strategic organisation group. Okay, so can I welcome then our next set of guests, which is led by Mary Arkley, who's the Chief Officer at the Greater London Authority. Niran Matharda, I apologise if I've got the name wrong, who's the Executive Director of Strategy and Communication here at the GLA. Ricardo Hyatt, Interim Deputy Executive Director, Housing and Land, GLA. And Charmaine D'Souza, Assistant Director, Human Resources and Organisation Development. And Sarah Mully. We've got a set of questions. Mary, would you like to do an opening statement, or would you prefer to go straight into questions?
All I would say, Chair, is I hope the paper that I submitted in advance has been helpful context for the discussion, but we're happy to go straight into questions.
Okay, thank you for that. I'm now going to move to Assembly Member Susan Hall to lead off with the questions.
Okay, thanks very much, Chairman. Mary, how many GLA staff were seconded to support the Strategic Coordination Group?
I think it depends what you mean by seconded. So formal secondments, we have a few, and those have evolved over time, and Niran can give a better indication of formal secondments. In terms of people who were sort of parachuted in to help in a way, I heard John Barradell talking about earlier, just getting on with it in the beginning. We've had, a couple of hundred people in some way or another supporting the work of the Strategic Coordination Group. So we can talk to either of those, Assembly Member Hall. But formal secondments, very few, although we have some now, formal secondments into the transition and recovery structures.
Okay, so how many formal secondments in the first place?
Assembly Member Susan Hall, we had approximately formal secondments, about 3 or 4. So Alice Reeves was one of those who was seconded into the intelligence cell. During when we had the mortuary group, we had 2 people seconded to work on mortuary planning formally in the SCG. And I can write back on kind of the others. I cannot remember them off the top of my head. But in terms of kind of formal people that we had put in for the duration, the other thing I would say is that Fiona Twycross and the Fire and Resilience team, so the Resilience team in particular, so that was Tom Layfield and his team, were working and have been working on response and transition full time for the duration of the pandemic.
Okay, and that adds up to the other 197, does it, just from that team?
No, so the 197 are people that have been working on response and also on transition now, and those are people that have been inputting, and you'll see from Mary's paper, inputting a great deal into the subgroups and the cells that were established as part of the SCG.
Okay, fine, thank you. So how was their work? How did we monitor their work and evaluate what they were doing? Mary.
The formal secondees, or the bigger.
No, the bigger group. We're only talking about 3 or 4 secondees. So
yes,
the other ones.
So I think the first thing to say is that we were very clear from the beginning that supporting the work of the SCG was an absolute priority of the GLA, and therefore of us as the senior team
to make sure that the SCG was properly supported. So as that structure developed in the way you've heard earlier this morning from Fiona and John and Eleanor, we remained in extremely close contact to make sure that the resource that was required behind those cells and subgroups was provided. And, you know, some of that, as we know, happened very quickly in very real time. But by the beginning of April, we'd begun to put some structure around that and some resource. But you know, if I might, I think Ricardo or Sarah, who are here because they sit on top of the directorates that provided most of the teams into this effort, I think could bring to light one or two examples about how that worked, how the food team supported perhaps, or the rough sleeping team supported and then were monitored. I think if that's helpful, I think that's where we should take this. Sarah.
Okay, so Ricardo and Sarah were in charge of the teams of people that were out, that belonged to us, if you like, and were out there doing the work.
Well, Sarah, I think it'd be good if you can explain how that worked.
Yeah, so I mean, maybe Mary's mentioned food, which is a good example. As you know, the GLA has some ongoing programs around food, so we have some staff who have expertise and networks in that area. But it became clear very early on, actually, in lockdown, that food supplies, for example, through food banks, were becoming a real issue. And this was something which was escalated through the SCG process. So this was actually something that the voluntary sector group under the SCG escalated as an issue. And it was particularly coming into the Easter weekend. They escalated this issue about food supply to food banks. And so what we were able to do at that point was to redeploy staff from both from the existing team in the GLA, but actually also from other teams. So I think across the period we redeployed 8 or 10 people, some for very short periods of time, some for longer, to come together and work with partners across the voluntary sector and with business as well. To make sure that we could find a solution to the immediate challenge of supplying food banks with food. So, you know, we literally, we had trucks out delivering food over the Easter weekend to make sure that none of those food banks ran out of food. And then what the team did after meeting that immediate need was make sure that we could put on a more sustainable footing the relationships at local levels between boroughs, who were of course supporting populations who were shielding, for example, and local voluntary sector providers. So what we ended up with was a network of partnerships at borough level, whereby each borough had a strategic partnership with the local voluntary sector to make sure that those connections were being made. And that work was coordinated in significant part by this team that was redeployed within City Hall. So we did that on a very flexible basis. And as I say, we had some people who were redeployed to do that for a matter of days and other people who worked on it for a matter of weeks. And then that has continued into the transition work. So we now have a small team still working to make sure that we have that resilience as we go through the transition period. So I think that's a good example, and it shows that, you know, we were able to be responsive when issues were escalated through the SCG. And I guess the answer to your question about how people were sort of accountable and evaluated, the answer is really through the SCG structures in most cases. So issues were escalated, discussed, evaluated at the SCG level, and in that case, when that immediate task had been completed, the SCG made a decision that, you know, the objectives had been met and the work was sort of de-escalated and stood down. Shall I hand over to Ricardo to talk about?
Well, if I can finish with you, I think that worked well. So well done and thank you for that. How many people have you got permanently in your food department, or we got, I should say, in our food department?
3.
So there's 3 regular people, and you deployed an extra 8 to 10?
Yes, at different points.
Yeah, okay, fine. So I take it, Ricardo, then you had the bulk of the people working under you, did you? Then if there were 200 odd people?
So the housing team's primary involvement in the immediate response was in regards to the emergency accommodation operation. to get rough sleepers off the streets. And we, within Housing and Land, redeployed around 12 staff to supplement the rough sleeping team, which numbers about 10. So we more than doubled the team to try and, work on the operation to get as many people off the streets as possible. And in fact, the operation started in mid-March because we recognised the direction of travel in regards to the spread of the disease. And we were able to put a plan in place quite quickly, working with local authorities to try and procure the accommodation needed. Now, the operation has been running for 6 months, and at the sort of top end point, we accommodated, we had in hotels a maximum of about 1,500 people, but over the course of the 6-month period to September, in total, we've helped 1,700 people off the streets. And that work continues because clearly, we are still in the midst of the pandemic, and we are now looking to how we can, help each person that leaves the service to ensure that they don't return to the streets.
No, because that's the most important thing, and it's really good work that's going on there. So you had, I must have misheard, you said you had 10 people join your team.
Yeah, so it was about 12 people. So the team itself numbers about 10, and at different points, up to 12 people were redeployed to support the work of the team and the operation. And just to flag as well, the team did also input into the SCG structure. There was a housing accommodation group set up to coordinate our efforts with boroughs and other partners in regards to the operation. So that was a key strand of the team's work.
Okay, and at some point, will you give some sort of report on how many of those people you've managed to get out of that dreadful situation and back into not living on the streets, however one would put that, because that's thoroughly good work. So we look forward to hearing that. So going back to you, Mary, then obviously there's lots of people that haven't come under either of these. So if they were inputting information, which I imagine for the mortuaries, etc., was important, who were they under?
Well, so we've only picked, Assembly Member Hall, 2 examples of the teams. So you'll see in the paper there were 6 subgroups. We provided significant numbers of people into 5 of those. So Sarah has talked about food, but we had a whole set of people working on funding available to the voluntary sector. We had people working on volunteering and coordinating a huge volunteer effort. We haven't touched on the people that we had supporting the health subgroup, which was significant. There was a communications subgroup in which a number of our staff played a role. And then the other one, we haven't got Phil Graham with us today, but the whole business impact work of the SCG, that was one of the subgroups that we led. Luke Bruce, our interim head of economic development, led that, and there were significant numbers of people under him. And then, as I lay out in the paper, the other piece of this is that there were other teams who were working more directly on the response as well. So, I'm very happy to represent my paper as a table with numbers rather than people, if that's helpful. But, the 200 come together from, in effect, an effort right across the work of the SCG. That's how we get to them. But we've only picked a couple of examples. We could talk to more examples now if you'd like. But the 2 we've heard are examples of a whole range of teams that we have.
I'd like to get a sample. I'm sure other people will, interest of what our teams were doing, because obviously a lot of our ongoing work stopped, quite frankly. What, of all the people that we gave to help, are there any departments you're particularly concerned about that didn't get work done that we needed done for the GLA? did anything suffer because of that?
So in the again, I'm going to ask Ricardo and Sarah if they feel that happened, and then I will come back with a more general point.
Shall I start? So I suppose the short answer is no. So we were able to redeploy people in order to meet this without, I think, without that having a direct consequence on our wider work. That was possible because there was work which we could not continue during the crisis. So it wasn't so much that we were stopping things in order to redeploy people. It was more that there were aspects of our work that we simply could not continue. So, I mean, to take an example, we had a small team of people in my directorate who were working on community activities and volunteering that was planned around the Euro 2020 tournament. Now, obviously, the tournament was cancelled. That work, you know, they did some work to resolve that and wind things down in an orderly fashion and sort of put it on ice for when it comes back. But that team of people were then redeployed to support other priorities. So, you know, yes, there were things that didn't get done, but I think certainly on our side that was in large part because of work which could not continue in the way it had been planned during the pandemic.
Okay, thank you. Ricardo?
From a housing and land perspective, clearly going into lockdown, the construction sector halted altogether. So immediately we put in place a temporary structure whereby within housing and land, people were assigned to particular partners, housing providers across the sector to gather intelligence on the impact of the pandemic and to try and understand how we could work with the sector to safeguard delivery and contribute to recovery on the other side. And, you know, one early outcome of that immediate work is we managed to negotiate an extension by a year to the current affordable housing programme by putting forward quite a detailed business case to government and working in partnership to ensure that, you know, the risks that are inherent due to the lockdown would be mitigated and, you know, to give the partners and the sector the confidence to carry on. In addition to that, just on work that was ongoing, prior to going into lockdown, the government had announced a new building safety fund, and we had to, in fact, I had to deploy people from other parts of the directorate towards that effort in working with government to develop the programme to ensure that we were able to launch a funding prospectus in July and to start to attract applications for bids, because clearly, you know, the ongoing building safety issue and challenges are quite important. So, you know, that was a key piece of work that we had to keep working on.
Okay, fine. Just remind me, how many people are in your directorate?
So there are 210 people there or thereabouts.
Lovely, that's fine, thank you. Mary, was there anything anywhere that was really put on hold because of what we had to do to assist?
Well, the obvious thing we put on hold was the Q1 reporting process, because of course that was due to kick off just as much as we went into lockdown as we'd come to the end of Q4, and so, you know, with the Assembly's agreement as well, and I spoke to the chair about this at the time, we felt that actually with everything that was going on, we couldn't deliver to the original timeframe for that. So that first set of financial and performance reports post-lockdown was all a month late, but that was deliberate because so many of our people were otherwise engaged. So I think as you know, in summary, it was a mixture of things we couldn't do. And I mean, Niren's got several examples of that in her area as well, particularly people related to events who were very quickly redeployed. Yes. And then on the big sort of finance performance corporate process, pretty much immediate decision to delay it all by a month to give us all a bit of extra capacity.
Okay.
Sorry.
And I think one of the important things was using the skills that we had within the organisation to support the SEG. So as Mary said, where events had been stood down, we used the team to help us with the procurement to assist with mortuary planning. So it was about using the skill set that we had and redeploying that where we could.
Okay. I mean, what is the GLA's longer term strategy to support Pan London COVID-19 response? And how is the experience to date informing this strategy?
I think Niran, you should start.
Yeah, I can pick up. Yeah. So one of the things that has been incredibly important to us is learning lessons from what happened and our response to the pandemic, and taking those lessons learned and now starting to plan for, unfortunately, what may potentially be a second wave. And so it is about ensuring that we have got the systems and processes within the GLA in place to do this, and also making sure that people, and certainly learning lessons from what happened before, know what would be expected of them if we had to stand up a response once again. So we are doing some planning right now with Fiona Twycross, Deputy Mayor, and her team in terms of kind of our response.
Good. Yes, she's a good woman. I know she's working hard, so that's good. So I'm thrilled that you've got a list of lessons learned. Can you send me, or the beg your pardon, Chairman, can you send the committee here a list of your lessons learned?
Yes, we can.
That's good. Thank you. I think I'll leave it at that then, Chairman. Thank you.
Okay, I'm going to bring in Assembly Member Caroline Pidgeon.
Yes, Mary, in May I wrote to you raising concerns about Assistant Director Decision 2448, which approved the spending of up to £20,000 to procure the services of a specialist organisation to manage the in-kind donation strand of the COVID-19 response, taking over from work that GLA officers have been doing. Can you provide us with more details of that organisation that was procured and any further associated costs for the GLA?
Sarah, are you able to do that?
Yes. So this was a decision that we took right in the middle of the pandemic. So just as a little bit of background, one of the roles which the GLA took on was helping to coordinate and try and effectively direct lots of offers from businesses, from individuals, from all kinds of sources that were coming in for people trying to support the London response efforts. A lot of those were coming to the Mayor, and they were coming to City Hall, so we sort of naturally picked up a role in coordinating those. I think what became clear as we were doing that work was that although we were able to do, I think, a good job of triaging those offers and putting them sort of into the right places, that we needed to put in place some arrangements that could be a bit more sustainable, and to make sure that we tried to get some sort of long-term benefit from this incredible outpouring of generosity. So we made the decision to involve Rocket Science with the organisation who we got involved to do this, because they had the networks across the civil society and voluntary sector. So it was to take on some of that day-to-day management of the offers and to help us build some systems. But the reason we got them involved was because we needed somebody who had those networks and the existing relationships across London to try and build systems that would have some longevity, and to try and make sure that this didn't just end up being a kind of emergency response. And there were some capacity issues on our side. So as Mary said, the GLA was very heavily involved in a lot of work relating to supporting the voluntary and community sector, which meant that the officers in the GLA who had that deep sort of sector knowledge and those networks were already fully deployed in managing other bits of the system. And this felt like a discrete piece of work that it was sensible to get some extra support on.
Well, has any more expense other than 20,000 been spent on this?
Not to my knowledge, but I can confirm that for you after the session.
Okay, and why did you not consider trying to use TfL staff, 7,000 of whom were furloughed, who may have had the right skill set, who you could have brought in to support this piece of work rather than going out with the contract to tender?
We did consider all kinds of options for covering this from within the GLA and from the group. I suppose my answer would be it's this point about this very specific requirement that we had for people with networks across London's voluntary sector. And our assessment was that was what we needed, and because of the nature of the work that TfL colleagues do, we didn't feel that there was anyone there who would have had those skills, or the networks rather.
Thank you very much.
Okay, are there any other questions from Assembly members? Can you indicate? Okay, I see no indications. I'm looking to the left and right of me. I'm not going slightly delay. I'm checking with members in the chamber.
Just Mr. Chair.
Look, can I just ask a question? Mary, I mean, it's so much probably for the future because our ongoing efforts to support the transitional team will happen. But shouldn't we start thinking about creating a cadre of officers at various levels for resilience type issues and emergency situations? That I'm not saying they have to go around with an IVIS jacket on their, or a badge or a tattoo on their foreheads, but where we know their skill set and their that they can operate outside their immediate environments in an emergency type situation. Shouldn't we put that in place? And probably it could be part of our volunteering issues. It's not quite volunteering because they'd be doing paid work, but in times of woe, moved into certain circumstances that will be quite challenging, but we know that we're confident that they're trained, pre-planned, they know that they're not going to be called out in the middle of the night, but certainly on recovery issues, that they could play a role. Isn't that something as an organisation that we should be considering at this moment? I know we can't do it for the next 8 to 12 weeks. That work will continue where we are, but I think for the future, not saying we're going to face another pandemic, but there will be other emergencies. And as a regional organisation or, with our expertise across, I think it's not unreasonable to think that we could offer that to others as a form of support, considering we are the home of resilience, if some sense, of the GLA family. And of course, the police are the police and they do their bit. The fire service do their bit, and as we've seen and know of, worked outside some of their issues during COVID-19 around that. I just wonder whether, and transport sadly had a number of staff furloughed, so couldn't transfer staff across in the way that we might have wanted them to do. But could we not consider that? Is it not appropriate to think of that? Or is that just, it's just not the dumb thing?
So Chair, my immediate response to that is I think it's a very good idea and something we should think about. Interestingly, one of the key lessons I think we have learned is that this event, and of course it's not over yet, touched many more of our staff than any other previous emergency or crisis. I mean, I know, so I wasn't at the GLA, of course, when the Grenfell Tower fire happened, and I know there were quite a lot of staff involved with that. But, this event has brought in, I talk about, about 250 staff. That is of an order of magnitude greater than any other scale at the GLA in terms of staff being involved. So, one of our lessons was very much, it took us, so everybody jumped to it, as I hope you can see and you've heard. Our challenge became keeping everybody clear on, where everybody fitted in, what the SCG was doing, what the Mayor was doing, what we were doing as the corporate management team. And that became more of a challenge because so many people had never worked in this sort of crisis structure before. So we've already got a plan to make sure that as we get ready for what is coming in the autumn and the winter, that some of those gaps in terms of a broader understanding of the overall command structure, a broader understanding of people's whether people fitted, that's already in place as we go into the autumn and the winter. This, I think, your idea, Chair, takes it another level, which saying actually now that we've got such a wide number of people involved, and with a greater sense of what a crisis like this is and what it demands, then I think we should take your suggestion and think through then, well, okay, what can we offer further in terms of support to London? And yeah, so very happy to take that on board and come back at some future point and talk about that.
Thank you. Once again to colleagues, any further questions on this? Now, can I apologise to Sarah? So I think I said your name, but I didn't say what your title was. Executive Director of Community Intelligence, GLA, and no disrespect was intended. I probably just felt I was rushing the meeting a little bit in terms as we reached the twilight zone, and I shouldn't have, and I apologise again to you, because I think titles are important.
Can I just say that there are questions to the earlier panel, if we direct them to the officers to forward on, and
Yes.
of course we don't expect an instant response given the pressures on them. But because of time, there are some questions that some of us could not
That's
ask.
a good point. We will come back and look at that and check with Assembly members, because there may well be some reflections of what's been said, and we may write to you further about the way that you've answered some of the questions. Thank you very much for this part of the session, and thank you all for your work and the contribution you've made during the COVID-19 period. Fine, we're now going to move back to the main agenda, where we've got two further items, I think, that we've got to deal with. So I'm now moving back to item, I just want to get the right numbers. So where are we? In terms of that, I've got item 7, or is it, sorry, do I need to? Yes, item 7, GLA Pay Award. I think Mary and Charmaine, who's going to lead on this particular issue in terms of the pay award for GLA staff?
I'm going to just make a short opening statement to bring you all up to date with some developments since I submitted this paper. Should I just go ahead with that now?
Yes, sorry, I've made a mistake on on the previous item. I think I need to formally close the previous item before we move on. So in thanking our guests for today for the contribution, can I ask the committees to note the report and the report of the Chief Officers attached in Appendix 1 of backgrounds in putting questions to invited questions, subsequent decisions, and B, delegate authority to me as Chair in consultation with party group lead members and Caroline Pigeon MB, EAM to agree any outputs of the meeting on item 6, which was relating to COVID-19.
Agreed.
Thank you very much. Agreed. Now, Mary, I can return formally to the agenda and get this right. I'll put my tongue in the right place. GLA Pay Award, if I can ask you to introduce the item then. Thank you.
Thank you. I think my understanding is this has been circulated to members, but I've also asked to just preface the item with this. So I just wanted to give you an update before we get into the discussion of the GLA Pay Award paper that you have on the agenda. So the paper, of course, relates to Unison's pay claim, which as head of paid service I receive. So you will have seen in the paper that I do not intend to accept Unison's pay claim as submitted on the grounds that it is not affordable in the present climate, given the need to make savings while protecting jobs. So in the paper that you have on today's agenda, I laid out that I proposed to offer a 2% increase for staff on grades 1 to 6 only, back to Unison, and to reject all other aspects of the claim. I have in the meantime made this offer to Unison formally, who have in turn responded formally, asking me to extend the 2% award to staff on grades 7 and 8. So of course they originally asked for 2% for everybody. I've gone back and said actually I proposed grades 1 to 6. They have now come back and asked me to extend that to 7 to 8. You will also have seen in the original proposal there was a request for a sort of one-off £500 payment to all staff, which I have rejected, and Unison haven't asked me to reconsider. And they've also asked me to make the 24th of December an additional holiday for all staff, which I have originally rejected, but again have been now asked to consider again. So in terms of the things I have been asked to consider by the Unison team, so I've obviously given this some thought, and I want to tell you that I am now minded to agree to extend the 2% award to grade 7 staff only, not to grade 8, but to grade 7, but that I do not intend to agree to the extra day's holiday. And I've spelt out the reasons for that in the paper that you've got. You know, our holiday allowance is already generous, and we've had a number of new policies recently that also allow other avenues for people to take paid leave in particular circumstances. So my rationale originally for restricting the 2% award to grades 1 to 6 was that it ensures that our lowest paid staff do receive an uplift. And this would apply to the 260 or so staff we have on grades 1 to 6, and they earn up to a maximum of £37,500 per annum. But I have looked again at grades 7 and 8 in response to Unison's latest request. Our staff on grade 7 are paid broadly in line with the average London public sector pay, which is £41,800, because the grade range for grade 7, the salary range for grade 7 is from 40 to 44,000. Those on grade 8, however, are paid above the public sector average salary in London, because their starting grade is 44,000 and goes up to 48,000. If I do go ahead and award the 2% uplift to staff on grade 7, this would add a further £110,000 to our total costs, and we would capture in that a further 100 staff who would receive an award. You would have seen in the original paper that we have always budgeted for a 2% increase for everybody, which would have cost us about £1.3 million. If I go ahead with this 2% for grade 7, we would still save just short of £1 million. We would save £950,000 from our budget, and that money would go straight to our savings target. And I have assured Unison colleagues that that's what will happen with any money that we save from this. It would go straight to meeting our savings targets, which, as you know, are substantial. So in my view, and of course I've discussed this with Charmaine as the senior HR advisor, I think this would represent a reasonable response to the overall pay claim. And so it is this bit that I am now consulting you on. It's to extend it to grade 7. Grades 1 to 7, 2%, no extra holiday, and no further payment to any other staff this year.
Okay.
Thank you.
No, thank you. Okay, so I've seen Assembly Member Hall, who wishes to contribute to the conversation.
Yes, just so to get it absolutely straight, everybody up to earning £44,000 will get a 2% pay increase.
Yes, that is the proposal.
Okay, and how much will that cost the Assembly?
I haven't got costings just for Assembly staff.
Okay, sorry. Okay. How much will it cost in overall?
Overall, that would cost. Sorry, yes, just over £300,000, £350,000.
Okay, and can we afford that, given that we're under terrible financial problems at the moment?
So that is the crux of the matter, isn't it? You're absolutely right.
That's what I'm asking you. Yeah.
Crux of the matter. So, in my view, we can. So in my view, is we will work so that we can afford it. It's almost £1 million saved off this year's budget, of course, because it's this year's pay award. But of course, it's recurring into following years because people will never get this 2% back, as it were. For the cost of 350,000, we do give a 2% award to our to our lowest paid staff.
Understand all that. Yeah.
So in my judgment, I think we will have to find that 350 in other ways. I would, but I think it is right to offer that award. I mean, the other thing I should say, and it's clear in the paper, but I haven't mentioned this morning, is of course nationally now Unison members are going to get 2.75.
Yes, but
so
if we could just
even these staff aren't getting the national award.
No, I know. I'm just concentrating
savings
on our situation at the moment. So can you then guarantee, if you say we can afford that, can you guarantee therefore that when we make budgetary savings that nobody will lose their job?
No, I can't guarantee that.
So we can afford it, but we can't guarantee that other people may lose their jobs because we need the extra money.
This 350,000 that we might save by not making these awards is not going to prevent us almost certainly needing to make people redundant because of the scale of the pressures that we face.
So the 350k, does that include pension contributions, NI and all of that?
That's all included, yes.
It definitely does.
Well, I believe it is. It should be. That's the costings I've been given.
Okay. If you, can Charmaine confirm that?
Charmaine, you're on mute.
Sorry, Assembly members. Yes, those are the costings, the total costings provided to us for the uplifts that Mary has set out.
Including that. Okay. I'm just concerned because I do think that perhaps if we've got to make such large budget savings and people are made redundant, perhaps we should be considering that at this point. It's only a point I'm making. But if you say we can afford this, then obviously I'll come back to you if we end up having to make people redundant, because I'm sure people would rather keep a colleague than have an increase. But you're the one that's in charge, so it's your call, Mary. I'll leave it at that. Thank you, Chairman.
Okay, I've seen two Assembly members calling. So Assembly Member Caroline Russell and then Assembly Member Navin Shah.
Thank you, Chair. I just want to raise a point that is in the Unison letter that was sent to you, Mary, which is, I mean, after, they obviously welcome the grade 1 to 6 offer, and then they're making their case for the staff on grades 7 and 8. Now, staff on grades, and I'm quoting from their letter, staff on grades 7 and above saw a real terms pay freeze in 2019 and a real terms cut in 2018. So even when that was measured against the lower CPIH rate of inflation. And they go on to say that this further erosion of the incomes of the GLA's middle earners is simply not acceptable. Isn't that a good point to consider, Mary?
Yes, we have considered it, and Charmaine has looked into that in more detail. But it would be helpful for her to speak to that.
It would, thank you.
Assembly Member Russell, yes, we did look into that, and that's looking back into last year. Of course, we did have a tapered claim last year, so we did include for grades 7 and above a 2% uplift. The Unison colleagues letter, of course, sets out, regardless the economic impact of inflation and others. So we have done our best in previous years to try and maintain the salary of those, as they put it, middle earners. In this instance, for this year, we've looked very carefully at the average salary for public sector workers in London, hence wanting, as Mary has set out, to extend our 2% offer to that particular group.
Thank you.
Assembly Member Shah.
Yeah, thank you, Chair. First of all, I'm actually pleased that we're able to make the new amended offer with regards to extending pay scale increase to grade 7 as well. Obviously, unfortunately, given the very serious financial situation that we face, we are not able to extend it to grade 8 as anticipated by Unison. On the question of this letter, which is dated 24th of August, am I right in saying that there's been no formal response made to that Unison letter to date? And we still have this report which has come to us before getting a written response from Unison. And also, isn't it that only this morning Unison have been informed about the improved pay offer in terms of adding grade 7 in the offer? I mean, Chair, and to Mary and colleagues, can we try and avoid this sort of situation where there is a dialogue with trade union, but and then we haven't got the written response or clear response, and we still have reports coming to, important reports coming to the members to agreeing. I don't think it is a good situation to be in. So something we can improve upon. And also, I believe that Unison wrote in to set up a working group to look at GLA's grading structure in a constructive manner. Is this not something that not only we agree, but write in to confirm and get this going? Because that will help us enormously to sort of have an ongoing constructive dialogue. So, Chair, yes, I certainly am in favor of including grade 7, and I would hope that in future we don't have situation where things have not been agreed or properly responded to formally with Unison, and that we also agree on the sort of working group which Unison has asked us to sort of set up. Thank you.
Okay, are there any
sorry,
further...
can I just respond very briefly to
Yes,
that? So actually, I've said from the beginning that I'm happy to have a working group on pay structure. So I think there's been a bit of a misunderstanding there. I've been very clear, even I think in my response, that I've agreed to that. So that is definitely in. I think this year has been a little challenging because, of course, the Unison team were great. They got their pay claim in very early. Because that hasn't always been the case, I understand, in the past, but they got the pay came in very early because of the financial situation, because of really having to understand the budget guidance and the savings targets for the GLA. I couldn't respond in a timely way, but I worked very closely with the team. They understood absolutely why that was, the Unison team. And what I'm trying to do now is get to an agreement and complete my consultation with you, as I must, so that we can lock this down and hopefully agree it and pay people that are getting the award, pay them the award. So I've done my best to try and keep the pace behind this with the Unison team.
Assembly Member Shah, again.
Chair, as Mary is going to speak to the unions with regards to the new offer as well as on working group, can we please have confirmation to all members on the committee what the final outcome is, and any response that we get from Unison to be conveyed to us? If that can be done, that would be great. Thank you.
Okay, Assembly Member Umesh Desai.
Thank you, Chair. Chair, I think it's important to put on record, it's in Unison's letter, but they do acknowledge the current financial circumstances, but go on to say that they feel the claim is modest and restrained, and something that I agree with. I agree with everything that Assembly Member Shah has said. Just to be clear, so Unison wrote to Mary on the 24th of August. They haven't yet had a reply, and as I understand it, formal negotiations are still continuing. I don't know if I understood Assembly Member Shah correctly, but are we, or what I'm proposing is that, do we have to agree this at this meeting, or can we defer it? And
we're not deferring.
Right.
We're not deferring. I think we don't have to agree this. This is a decision for the Chief Officer alone.
Yeah.
We can give some responses, which is what members are doing in terms of issues that she needs to take into account.
Yeah, thank you for clarifying that, and I'll go by what you said. I just want to make a point about the holiday situation. MOPEC staff enjoy 32.5 days of annual leave, which I understand is 2 days more paid leave than GLA core staff. Is that right, Barry? What concerns me,
right.
if that is right, it's about consistency of practice across the GLA group, something that I raised in another context when we were approached by the Metropolitan Police Federation about police officers being exempted from the congestion charge, something that the London Fire Brigade staff, their congestion charge is paid for by the fire service. But I digress. To come back to the holiday situation, look, Chair, I don't wish to be flippant, and I don't make this point lightly, but in these unprecedented times, the request to have Christmas Eve as a day's leave, I'll make 2 points. Firstly, we now got to look at new ways. The world is changing around us fundamentally about how to reward staff short of giving them sort of increased pay. We've got to look at non-monetary ways of valuing our staff. It's like with the NHS stuff. It's all very well, people go out clapping every Thursday and we talk about our frontline services and how much we value them and all that. But that doesn't pay people's bills and mortgages. To come back to the question of annual leave, as I said, I don't make this point lightly, I don't make this point flippantly, but Christmas Eve, come on, tell me anyone, what's actual productive work that takes place on Christmas Eve? I mean, lunchtime, come on. Most staff actually looking forward to going to the pub at any workplace environment that I've been in, or to go and get their shopping done. I actually think that that's modest demand. I speak for myself, but I think that's something that we should actually consider seriously as a way of acknowledging of our frontline staff, and especially since we're not giving them the pay rise that other local government staff are getting. So I rest my case, Chair.
Okay. I think the members have made their points well known. Mary, you never asked for any clarification from any of those. You fully understand the issues that have been raised.
Yep,
okay,
thank you.
well that is our response on the committee. I think then we note the consideration set out in the report. I'd like you to pick up some of the issues that Councillor Navin Shah did in terms of reporting back. I suppose the final say is I wish we were in a different financial set of circumstances, to be honest. I've never felt comfortable with us breaking away from the national pay bargaining issues. I can understand why we would wish to do that today. Maybe I'm old-fashioned around that, but actually it probably isn't affordable in the circumstances we're in at this moment in time. I like to keep things straightforward and simple, but I'm international bargaining rather than local bargaining in some ways. I think it's cleaner and swifter in some issues, but that's a personal preference. So I think that's where we should leave it and note the considerations set out in the report. Can we agree that as a way forward? Let's move on to item 8, business support functions in the Chief Officer's Directorate and the Mayor's Office Directorate. Proposed changes to the GLA establishment. Now, who's going to lead on this one? Mary?
I can do, if you want me to introduce the paper. So, as I set out, we have a proposal here to put together one executive support team to support both the corporate management team and some roles in the Mayor's office. The idea is to create that team on the CMT side of the House, so it's a team that would report into CMT, not into the Mayor's office, but to create a team that that I guess gets closer to meeting what I believe to be sort of support standards that exist outside the GLA and in private sector and public sector, where essentially we say we have one executive support assistant, one PA, whatever we end up calling the role, for 2 principals. That is the model that we operate in the corporate management team already. It is not a model that is consistent in the Mayor's office. There are 1 or 2 examples of people supporting 2 people, but mainly it's a one-on-one support at the moment. So that's part of that. It's about making sure that we have a executive support function that is that has sort of leadership in it, capacity to develop people, a career path offered for people in this area, and also that starts saying actually we need to be consistent here in what we ask of our executive support officers at these types of grades. This isn't driven particularly by the current situation, by the COVID piece, but of course the roles of personal assistants and executive support officers have changed considerably with everybody working remotely, and a lot of the role as it used to exist, the picking up of people, the running around the building, that type of stuff has disappeared. And we need to make sure that as we go into what I think is going to be the longer term future of mixed working, many people remotely, some people physically, again, we need a way of making sure that the personal and executive support that people need is properly provided. So that's at the heart of the proposal. Of course, there are staff directly affected here, 17 posts directly affected. We launched the formal consultation last Tuesday. It's a 30-day consultation with staff, which ends at the end of September. And of course, during that period, I need to consult through you, the Assembly, and I also need to consult the Mayor's office through David Bellamy. I think I'll stop there, Chair, unless you want me to say any more at this point.
No, that's fine. Assembly Member Caroline Pidgeon.
Yeah, Mary, I have some concerns with this paper. I understand the sort of logic when you were looking at this, but if you were comparing with the civil service, I think most private office staff are apolitical, and it's very distinct roles. You're talking about staff who work for your chief officer team, already sharing and supporting a couple of members of that team, and then the political appointees to whoever the Mayor of London is, and they're specifically separated, aren't they? The Mayor can appoint, about 14 posts now, based on whoever he or she wants. So I think they're very, very different roles, and I think it's very dangerous what you're proposing here to muddle this support, because your chief officer team and you are there to also support the Assembly. So how could I have confidence if I had sent you something which was critical of someone on the Mayor's side, and it was going to somebody who also worked for that person on the Mayor's side? I think that would be putting that individual in a very difficult position as well. So did you consider as part of this just looking at streamlining and improving the executive support in the Mayor's office, similar to what you already have in place for your chief officer team?
So we've considered it as part of developing this proposal, as you would expect us to. I think I'll come back to your first point in a moment, Assembly Member Pidgeon, but I think one of the problems here, so as you say, we already have this structure in the corporate management team, but because everybody's supporting 2, and we're still a relatively small corporate management team, we just have 3 posts supporting us. So the moment somebody goes sick or somebody's on holiday, then we get into difficulties of cover. On the mayor's office side, if we go to this one person supports 2 model as well, you quickly get into the similar problem. It would be a slightly bigger team, of course, but not so big as to suffer from problems in terms of cover and holiday and the rest of it. And certainly since I've arrived in the GLA, I have never allowed agency cover or for holidays in the corporate support team. Everybody has to cover for each other. That's part of the deal. So there is a part of this is about resilience of smaller teams and smaller teams' ability to cover, to get to cover in and to cover for each other. On your first point, absolutely accept the validity of that point. And I think that comes into, in the end, so there's a process that we obviously go through on consultation. If we go ahead with this, ultimately then there's the question is who supports who in this, and who is paired with who. So are David Bellamy and I going to share the same PA? No. Who we pair up to be supported by, I think, will be critical to meet your concern. And frankly, the reason why you can send me something now that's critical of anybody or anything is because I know my PA won't share that with anybody and won't gossip about it or won't divulge it in any way. That, of course, is part of the role of these senior PAs. And you're right, you don't want to put somebody in a very difficult position where they're working for 2, they might be working on the other side for the person that's being criticised. I think that's your point, isn't it? That's, I think, going to be about, okay, well, within this structure, how do we put some extra protection around your point? I think we can do, I'll need to think about that more, but I think we can do that by making sure that we're very careful about who is paired up with who in terms of support. Remember, the whole structure it is proposed reports in on the corporate management team side now, not on the mayor's office side. Okay, well, but I can see why you're making that point and you're concerned, and we've got plenty of time here. We're only at the very beginning of this 30-day consultation. If we need to work some of these things through in more detail offline. That we've got time for that.
Yeah, no, I understand the proposal and what you're trying to achieve. I think they need to be separate, and it may be you need to look at what capacity you have in your corporate management team to support you. But I do not think the same PAs should be supporting mayoral appointees. And yes, there's clearly room for some savings and rearrangements in the mayor's office. I was interested to read that Amy Lame gets one whole person to support her, whereas other deputy mayors have to share PA support. I think there is something there that needs to be done, but ultimately I don't think they should be muddied at all, and I think you create an impossible situation if you go ahead with the structure as it is. Are you considering any political restrictions for these new diary manager roles?
I need to ask Charmaine that. I don't think they're politically restricted now. Charmaine? They're not senior enough to be politically restricted.
Yeah, that's correct. Well, we do take a look at political restriction, Assembly Member Pigeon, when new roles are created. But overall, in the main, that's deemed reasonable for a senior level of grade. So wouldn't be applied in this situation, ordinarily.
Okay, well, there's not time now, there's lots of concerns, but I really would urge you to look at the grading, whether what you're doing is right, some of the escalated grades, but also to keep these 2 teams separate, though you might want to streamline them further, because it really worries me. But also, I mean, it links to the point earlier. It still amazes me that MOPAC has very different terms and conditions, and Mesh just highlighted staff there get 2 extra holidays. Well, their chief exec has just appointed this super duper PA on 67 to 75k. You know, there's something not right across all of these bodies when there is such a difference in kind of personal support, which of course people in senior roles absolutely need, but at what price? Thank you.
Okay, no other contributions from the committee. Therefore, I think, sorry, Assembly Member Keith Prince.
Text you and email as well. I have to say I completely share Assembly Member Pidgeon's worries on this. I think it's too much to ask for an individual. When you have a PA or support officer, you build a very close bond with them, and it would be very difficult for them. I think you're putting them in a really impossible position if they know that the person they're working for is under attack in some way, and for them not to share that. I think that's really too much to ask, actually, and that's no criticism of the individual. But we saw fairly early on in this administration where people had searched through Boris's emails, and some of Boris's emails, which were personal and private, were published. And then if you've got people who are tied to politicians, they may be asked to do the same job. How does that work? I think it's an absolute recipe for disaster.
Okay, I think you've heard the responses from the committee. I think some of those sentiments are shared by the committee, to be honest. We'd asked you to probably look again at some of those proposals. I don't understand how a prestigious organisation that is a regional body is getting to a position where our head of paid service has to have had a shared resource in terms of a PA or even a chief of staff. I don't believe, well, it's interesting how they work, is whether that they can be done on 50%. You know, I don't think you're asking a lot of people if that's the case in terms of that pay. I can't imagine a chief exec of a London borough sharing their bloody PA resource with other teams, unless they're in a bigger way. Just in terms of the overall support, it just makes me think, and it was interesting what you said about the 3 exec directors having, and the issues of someone going sick. I find that just amazing when maybe we've not served you well, to be honest, and looked at the support that you need to be a head of paid service. Now, I'm all for efficiencies and I'm all for efficient ways of working, but I'm clear there are some issues around issues to do that, you know, I don't think you need reminding, because I think you're constantly reminded by other colleagues about your dual role to both the Assembly and to the Mayor. And in that, there's a maturity of accepting there is a major proportion of your work which will be devoted to the Mayor, but I just think it just places a different emphasis on that role. You know, you need to give some more reassurance about that to Assembly members to allay their fears. And if you proceed with this, that's what I think you need to do. You need to give that more attention. Okay, colleagues, can I leave it there? So we're asked to respond. I think you've had some responses, and I think we best leave it at that, if that's okay. And let's move on to item 9. Date of the next meeting is scheduled for the 3rd of November 2020 at 10 a.m. There being any other business that I consider urgent, I therefore close this meeting. Thank you very much.